Good evening everyone. I am Anupama Menon welcoming you to a brand new episode of BMC Global Live Al-HILAL Health World, Nothing But Lifestyle. This is a talk show exclusively designed to provide valuable information and assistance to all of you on your journey towards good health. In the last episode, we debunked a lot of dental myths which are prevalent. In today's episode, we would like to focus mostly on dental caries. This is a common problem that affects people of all ages, right from young children to elderly people. And preventing oral cavity or dental caries is one of the most important steps that you can take to maintain good oral health. To throw more light on this topic of dental caries, we are delighted to have with us today Dr. Sajitha Zameer, Senior General Dentist at Al-HILAL Hospital, Moharrak. She comes with a wealth of experience, 18 years in Saudi Arabia and India, and over 10 years of experience in Bahrain. And her area of expertise is laser treatments, restorative and cosmetic procedures, endodontics, and prosthetics. So let's move over to her and know more about dental caries. Welcome to the show, doctor, and thank you for joining us.
Thank you.
So doctor, what is the most common disease that affects oral cavity?
Is the tooth decay or dental caries is one of the most common widespread disease that affect the oral cavity. It is the one which is most treated and the most preventable one.
So doctor, what exactly is dental caries or tooth decay? How would you define it in medical terms?
It is a microbial disease of the calcified tissues of the teeth, causing pain, cavity, infection, or sometimes loss of teeth.
And what are the most common causes of tooth decay? Because we have been told that excessive consumption of sugar may lead to it, or not brushing the teeth properly. So
Yes.
what are the most common causes in your observation?
Decay or cavity on the tooth is associated with lot of factors. First and foremost, it is the dental hygiene, improper brushing, inadequate flossing. It depends on how you take care of your teeth by flossing, using mouthwash, rinsing your mouth properly after food. Secondly, it is the type of food what we consume, the eating habits of the patients, the bacteria present in the oral cavity. Last but not the least, hereditary also plays a small role in dental decay.
Okay, so three factors. I think
Three or
your
four
oral
factors.
hygiene, oral hygiene is very important, and flossing, regular use of
Yes,
mouthwash. And what would you suggest? Brushing after every meal or just twice a day would
The
be
main
fine?
meals, brushing after the main meals
Okay.
is always better.
So what are the tips that you can give the viewers to prevent tooth decay? Anything that we can do at home to prevent further decay of the tooth?
Yes, there are a lot of things that we can do to prevent the decay. As I told you, brushing is the most important thing. Brushing and flossing the teeth will prevent the food particles that stagnate between the teeth. Brushing twice a day with flossing of teeth at least once at night prevent the decay to a certain extent. A balanced diet that is low in sugar prevents the decay to a certain extent.
Okay.
Application of fluorides by the dentist prevents the decay, especially in children. We do take care of children at the early age. Avoid acidic beverages.
Okay.
And finally, the application of sealants will prevent decay to a certain extent.
Okay, just now you spoke about sealants. So what exactly is dental sealant?
Sealants are actually protective coatings that we give on the surface of the teeth. This will prevent the food particles stagnating, bacteria stagnating onto the tooth. It's like a glossy film that we apply on the tooth.
Okay, so is this a simple procedure done by the dentist?
It is a simple procedure done by
And
the
is it
dentist.
painful or
It is not at all
it's
painful.
not at all painful. So I guess kids would also be
One visit to the dentist, we can apply the sealants.
And can this be done for any age group, or you mostly recommend it for children?
We normally go for the children to adults.
Adults, at any age this can be done.
We can be.
Okay. So doctor, how often do you think someone should visit a dentist, even if we don't experience any dental problems as such? Do you think still it is necessary for us to pay a visit to the dentist on a regular basis, just to make sure that there are no cavities, which there's no onset of cavities? So how often do you think we should visit a dentist?
To maintain a good oral hygiene, we normally recommend the patients to visit the dentist once every 6 months.
Okay.
Routine cleaning will prevent the build-up of plaque and the stain deposits on the tooth, thereby maintaining a good health. Routine scaling will prevent the deposition of plaque and stains on the teeth, thereby giving a healthy gums, providing a healthy gums and dental decay.
Talking about stains, we all love to flaunt our pearly whites, but a lot of times we have seen this, the teeth tends to develop a slight yellowish color, or there could be some other discoloration also. So how do we make sure that our teeth are always shining in bright and white?
Although there are a lot of products available in the market like whitening toothpaste, whitening strips, mouth rinses, it may not be as effective as professional treatment given by the dentist.
And there are some home remedies also, I guess. It's better to avoid them and then visit a dentist
Yes.
and get a proper treatment done.
In office, we have in office tooth whitening systems. With Zoom, we have tooth whitening with lasers, and we do give custom made trays after we finish the in-office whitening procedure for the patients to take home. So they do touch-ups at home after 2 to 3 weeks of their professional treatment.
They can do it at home. The touches can be done at home.
The touches can
but
be
it's
done
not
to
harmful.
get a brighter shade.
Okay, but it's not harmful for the teeth in any way, right? It does not take
There
away the
are-
strength of the teeth, or
It doesn't affect the strength of the teeth.
okay.
But sometimes patients do, depending on their periodontal health problems, there can be a chances of sensitivity which is reversible.
It is reversible. So
Very
that's part of the treatment, but it can
Yeah,
be
it is
reversed.
reversible.
Okay.
And there are certain gels that we give the patients to avoid sensitivity.
Okay. And talking about tooth decay, what are the treatment options available? So whenever we think of dental caries, the first thing that comes to our mind is if it's minor, then a normal filling. Otherwise, one thing that we are all afraid of, root canal. So are there any other treatment options available besides these two, or what are the
For the
ones?
dental, for the decay, it is the normal fillings that we
Filling.
give with composite resins. For small cavities, we give normal fillings with composite resins. This is matching to the shade of the tooth. Excessive decay, fracture of the teeth, we go for crowns. Deep cavities involving the pulp, we go for root canal treatment. If the decay is severe and the treatment options fail, then finally we go for extraction of teeth. However, we have treatment options to replace the missing tooth too, with the help of removable prosthesis, crown and bridge,
Implants. So at least it's reassuring to know that it can be taken care
can
of.
be
There
taken care of.
will be no permanent loss of teeth.
Teeth.
It can always be replaced in the worst
If
case
the
scenario.
decay is too excess and then it is unrepairable, then the only option is to extract the tooth.
Okay,
But
and
in
what-
that cases, we do have treatment options to replace the missing tooth too.
Okay, and what are the risk factors? Let's say a tooth decay is left untreated. Maybe that person suffering from that is not experiencing any pain, so they tend to take it lightly. They may
Lightly.
not even visit a dentist. Do you think it's risky for the general health if a tooth decay is not taken care of at the right time?
There can be pain, difficulty in eating, breakage of teeth, sometimes there can be pus, swelling of the face, finally loss of teeth.
So it's timely medical intervention is extremely
Timely
important.
intervention is necessary.
Very important. And doctor, you spoke about how important brushing the teeth twice a day is. So do you think brushing the teeth quite hard will lead to an erosion of the enamel, and does that lead to sensitivity of the teeth? Because that's something we all struggle with, however much we are told brush it gently, we have a tendency to kind of apply more pressure than required. So how does it affect the teeth?
Yes, definitely. Overbrushing can lead to problems on the tooth as well as gums. Overbrushing can lead to tooth sensitivity, enamel abrasion and gingival recession.
Okay, so we have to be extremely careful about the pressure that we are applying. And these days, so many different kinds of toothbrushes are available in the market. You know, we have soft, medium, and hard. So, in your opinion, which is the ideal one?
If you are a person who is frequently taking care, brushing frequently after meals, soft to medium brushes will be fine.
And how often do we need to change the toothbrush? Because I believe there's bacteria present in the toothbrush also when we are brushing the teeth. So, do you think it's important to change it quite often?
We advise normally to change the brush every 3 months.
Every 3 months, okay.
Frayed bristles can be damaging to the gums and less effective in plaque removal.
Okay, so soft to medium bristles and at least once in 3 months we need to change our toothbrush. So, doctor, before we wrap up, any takeaway message for our viewers today?
Yes, brushing the teeth at least twice a day with flossing at night, a well balanced diet with low sugar content, avoid acidic beverages, getting fluoride treatment done at the dentist's office and application of sealants. To have a more comprehensive understanding of your dental problems or any dental health issues, please call up and book an appointment at Al-HILAL Hospital Dental Department 33601417.
Thank you so much, doctor, for coming on this show today and for giving us a detailed insight into dental caries and how to prevent it. Thank you for your time. We appreciate it.
Thank you. Thank you so much.
Friends, I hope all of you found this episode very informative and useful. A genuine smile, of course, it comes from the heart. But a healthy smile with pearly whites can only come with good dental and oral care. So make sure that you brush your teeth twice a day. Do pay regular visits to the dentist. Keep smiling and keep spreading happiness. Till we meet again next time, this is Anupama signing off. Good night and stay safe.